Sometimes as a patient it's hard and you feel like you're not making progress, and you actually are. So very early on I'll be encouraging you and supporting you through that important processes in wound healing.
And she can come to your place and do the dressing change, the massage, etc. in the comfort of your home. So let's dig into the scar management. So first thing, after surgery, when the dressing should come off.
Absolutely. So
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Hello everyone, and welcome to another episode of my Beauty Talks by Dr. Matteo Vigo. Today we're talking about something which is as important as the surgery process itself, which is the post-op management after the procedure you've done. I'm here today with Nurse Cassie. She is a queen of the scar management, the wound therapy, and the lymphatic massages. So if you want to heal like a superhero, listen up, because she will give some great advices. Thank you so much for being here, Cassie.
thanks for having me.
So introduce yourself a little bit. Who are you, where you're coming from, and why you're so expert in scar management?
So my name's Cassie Purvey. I'm Australian trained, originally burns specialist, but I've got postgraduate and master's training in both wound and stoma care. So my passion is all things wound and wound healing related, including scar management and lymphatic massage.
Okay, that's great. So Cassie and me started working together not long ago. She found me on LinkedIn. She came to me and said, I can offer these services for your patients. And I was looking for somebody I can trust. So I started giving her little patients, one or there, and see that she was absolutely great. So we started working together. So let's dig into the scar management. So first thing, after surgery, when the dressing should come off, first things that patient ask.
Absolutely. So recommended, and obviously this is guided by the surgeon themselves as well, but in the first 48 to 72 hours, normally we'll have a first check just to make sure that everything is healing well, that there's no drainage, and then put a new dressing on that will stay on for a little bit longer for the second time.
Oh, okay. I know that patient comes up with very strange things, like they put duct tape on the scar, etc. Duct tape is great for many things and not for scar management, right?
Absolutely.
So it's very, very important. And also another question is that, okay, I'm healing, what should I eat? What is the best food that can help me? So should I get along with the pizza? I'm Italian, so for sure, I love pizza, but is it good for the scar healing?
So this is something that I think people forget about, but it's one of the most important processes in wound healing is having a high protein diet and actually really concentrating on what you're eating, and think of it like fuel for your wound healing. So looking at all these sort of healthy green leafy veg, lean meats and things like that you're eating frequently and helping your body to heal quicker. Also looking at vitamins as well, so they play a really important role in healing. So the vitamin C's and zincs and things like that is really important to have as a supplement as well. Okay,
so we don't use the pizza as a healing food. Okay, we use pizza for healing our soul, but not the scar. That's very important.
Exactly.
So what is the signs that something's going wrong? The patient, there is something wrong with my scar and there is an infection maybe. What are the first signs the patient should look for?
So the first trigger is really going to be pain, and you do expect some pain after having surgery, of course, but your pain should be getting better each day rather than getting worse. And so for me, that's one of those triggers that after the first 48 hours, if you're not getting an improvement in your pain levels, we need to have a look and see what's going on. And that coincides with your dressing change as well. Some of the later signs are redness, a little bit discharge from the wound, swelling, all those types of things. So it's really important and to acknowledge it and to let us know so that we can actually act quicker rather than sort of pretending it's not there if it does happen. So
yeah, exactly. So don't wait until your scar looks like auditioning for a zombie movie, but absolutely contact me or contact Cassie if she's involved in your healing process in order to have an immediate management of it, because if we take the condition, the infection, the little complication that can happen in a surgery on time, we can sort it out in a perfect way. You will have absolutely an amazing, outcome and result. So that's very, very, very important for us. Absolutely. And what are the signs that everything is healing nicely, so the patient doesn't have any problem? What the patient feels?
So obviously your pain will reduce, but one of the major things is itching. And this is as all those new nerves start healing and regenerating. And it's one of those first signs that can drive you a little bit crazy. But there's ways to manage that. So using antihistamines, and also once we start taking the dressing off, massage and moisturization really helps, and multiple times per day.
Okay, and most important, if you feel the itching, do not scratch your scar. Don't turn into an art piece because we see some nails there, and it's very important to avoid that. Okay. You mentioned the massage, and you're expert also in massage and lymphatic massages, but not only. What kind of massage is important, and how do you teach your patients to do the massage? That's very important for me.
Absolutely. So lymphatic massage is really important, and the reason that you need to go to someone that's qualified is they need to know the lymphatic pathways for you. So there's, depending on where your surgery is which pathway will map across your body to be able to get some of that swelling down, but also it helps with the desensitization and scar management, so that you get rid of that heaviness feeling that you might have after having something like implants, and it helps you to recover a lot quicker.
How often do you recommend a massage done from a professional like you or by themselves? What is the difference and what is the frequency?
So 2 to 3 times per week initially, and something that's close to me is I like to teach my patients eventually, so that you're not having to come and see me all the time. It's just initially we can discuss the pathways and everything, and I'll train you over those first few sessions so that you can continue to do it daily and more frequently at home, so that you can heal a lot quicker. Yeah.
What I like about working with Cassie is not only his professionalism and preparation on the topic, but the fact that she has a special license in Dubai, and she can come to your place and do the dressing change, the massage, etc., in the comfort of your home. And that's very important, because especially after big surgeries like a tummy tuck, a body lift, patient don't want to travel to come to the clinic to see me, etc. So having somebody who can really come to you, knock your door, and then in your bed do whatever is needed for the healing is very important. I think a patient appreciate that, right?
Absolutely.
A lot.
And I think even some of the first showers that happen after, if you're nervous about that, to come out and guide you through that process, what you're looking for, and how your wound is healing, and coach you through that is really good as well.
Yeah, absolutely. So let's say there is no infection, the scar is healed, the itching starts, etc. The dressing is off, so now what the patient should do? How they can treat the scar. Of course, I know all these questions. I'm just asking her so you know better, because I can answer them, but it's nice to have somebody who does this 24/7, so it's absolutely specialized. So what is the best cream for the massage, if you have to use a cream, and what is the best scar cream that we can suggest to the patient? We don't make any brand name, but just the idea.
So looking at vitamin E creams, silicone-based creams are really important. There's a lot out on the market as well now. It's kind of increased in awareness as the evidence supports it. So looking at massaging frequently, so 2 to 3 times a day, and you have to be careful obviously with your garments as we start reducing the dressings and taking them off, that you're not getting any friction, rubbing anything anywhere. So making sure that they fit well and that you are wearing them as well. I know some people don't like wearing them too frequent.
I know, but yes.
So that's really important in that process. But the whole scar formation is sort of over 3 to 6 months until you have a mature scar. So you have to be patient. What you might see...
A patient.
Exactly. What you might see in the first sort of few weeks is not going to be the end thing that you'll see. So,
absolutely. And I always tell the patient, if there is any minimal revision to the scar, I will do after 6 months, when they know that scar is not going to change anymore. Absolutely. That's a result, because before I can see a lot of transformation in positive, and the patient will then have a scar which basically disappears or become very minimally visible. That's important. I have a question, because this is I have an opinion, but I want to hear your opinion, and a lot of patients ask me this: what it's better, the silicone cream or the silicone patches? What do you feel it's working better?
I feel Like the patches, I think sometimes produce a barrier as well from friction in the initial stages. For me, even personally, I think it's all about the massage and actually doing it frequently and not sort of once a week, but multiple times per day. I feel like that is working. I think a lot of these things support that, but ultimately the increased blood flow that you get from massage, breaking up any of that scar tissue and everything is really the gold standard. And there's a lot of similar products out there that do the similar thing, but for me it's applying it.
What I try to suggest the patient is during the day to apply, and then maybe overnight put, when you cannot massage when you're sleeping, so you put the silicone patch so it stays there. There is no risk that it comes off because it's quite well adhesive. And this help you to heal faster. And I've seen pretty good scar. I always try to also change strategy in terms of the sutures I'm using, because some patients have a reaction to the sutures. You can use barbed sutures, you can use monofilament, multifilament, it depends. And I'm always trying to adapt myself to understand which one works better. And there is also a way to do the dressing, the waterproof dressing or not, which I'm always trying to bring the patient to the best outcome, because at the end of the day you have a nice result, a nice shape, and if you have a very horrible scar, you feel your surgery didn't go well.
Absolutely.
So that's why it's very important to take care of your scar. Okay,
definitely.
And for the massages, which cream do you suggest? Not only the scar, the massage of the whole area that has been treated. Is there any cream in particular that you suggest?
So for the actual lymphatic massage, like oils, but definitely getting away from anything that's got perfume or sparkles or anything in there. So it's not a glitter show for it's actual medical treatment. So everything that's sort of neutral and natural.
Exactly. No color, no perfume. No, that's the best thing.
Exactly.
Absolutely. And also the consistency should be really, really soft and moisturizing. Another topic which is very frequently asked from the patient, and we have a case recently where the patient didn't shower for like 10 days after the procedure, kept the dressing on, and she developed an infection on top of that because she was not in Dubai, she was not coming to see me. So the moment she went to see Cassie, she said, "Oh, what are you doing?" When is the best moment to shower after the surgery, and how often, and what is your process?
So we'll guide you through that, and I think after that first dressing change that happens sort of after 72 hours, we'll look at how well, we say approximated, how well joined the wound is, and then we can start guiding from there. But it is really important that it's timely. You don't want to keep things covered up and hidden, but you also don't want to shower too early as well. So it's definitely something that once we pull the trigger and tell you to shower, that's really important that you do that every day. Yeah.
And also it's important that the shower is not, you're doing your new commercial for the shampoo with the splashes, etc. You need to do a clean, quick shower. I also usually give the patient, especially if it's a body surgery, I give a patient a chlorhexidine, which is a disinfectant sponge before the surgery, and then 1 or 2 sponges after, so the first shower. Because in this way, we not only clean the skin of the patient, but also we disinfect, and we keep it, especially in areas like the groin, the armpit, because these areas can develop a little bit of infection, and we want to stay away from the infection as much as we can. Because for me, the infection is the thing that takes longer to heal. Okay, other things, other little complication can be managed in 1 or 2 weeks, but if the infection goes deep, etc., we can take up to 6 weeks, 8 weeks to completely heal the patient, and we don't want with heavy doses of antibiotic, etc. So the infection, can start in the hospital. That's why we have strict protocols there, but then starts at home. So if you have pets, if you have these things, you need to be really careful. Wash your hands many times, especially, and keep your wound clean. That's
absolutely
very, very, very important. So I already said that, but any post-op precautions that you suggest to the patient? What should be the gold standard for the patient after a procedure to avoid the problems?
So it's looking at reducing anything that's going to cause friction and shear to the wound. So anything that's rubbing, your wound is still, whilst it might have that initial stages of healing, it becomes a lot more fragile and less resistant than the rest of your skin if there is any pressures or rubbing that happens. So just keeping aware of that, especially as you start wearing garments or bras and things like that again, that they're fitted well, and like wearing a good shoe. If you've got a shoe that's too small or too big, you're going to get rubbing. The same thing happens for your garments as well. So making sure that they're very well fitted for you. And then after that, it's just really that massage and moisturization to really help get that scar back to feeling like normal skin again.
Yeah, that's absolutely a very good message, because again, I always tell the patient we have two players in the management of the whole surgical procedure, and one is me, of course, what I'm doing, and one is the patient. The patient has a very important role in taking care of themselves, because I've seen a lot of patients that don't care. I had a patient who came after 3 days of a blepharoplasty. She removed the stitches by herself. I saw it was healed, I removed it. So don't take initiative, please. Come and talk to me or Cassie, or Sarah. She's also there to give some guidance. Of course, she's not an healthcare professional. Actually, she can have a degree now in medicine because she learns a lot. But she's always in contact with me or with you for anything. So don't take initiative by yourself, because that sometimes is not the right thing to do. And also what I tell the patient is very important for the quality of the scar. We don't only have two players, because I can be the best surgeon in doing the sutures. You can be the best patient, but then your skin is something we cannot control. So the rule is that the whiter you are, the better the scar is. And the darker you are, the worse the scar is. But I've seen the opposite way. I've seen super white people with horrible scars, with keloid hypertrophic scar, and very dark people with just a single line. So
absolutely. I think looking at any scars that you've had before, whether that's from falling over as a child or anything, how you've healed previously can kind of guide what's going to happen post-operatively and help us sort of understand where we need to focus on, and if you are at more high risk of hypertrophic scarring, so that's really important. Okay,
and what is, from your point of view, the signs that, the scar is healed, is closed, there is no sign of infection, but what is the sign that the scar is not going into the right direction of the aesthetic outcome? Because I have a lot of patients that, I have horrible scars. They show me maybe I have a little cut here, which is a single white line. So you can see it's visible. Remember, the scar is visible. When I use a knife, or even when you fall, etc., if there is a cut in the skin, you can have a minimally visible scar, but invisible scars. And I know a lot of surgeons who, pretend to say, I will give you an invisible scar. No, the scar will be there. It can be very good and minimally visible, but it's there. Absolutely. So what are the signs actually that the patient should say, okay, something is not going in the right direction?
So looking at if it becomes lumpy, also from some of the more advanced surgeries, if it becomes adhered to the bottom, so it's not movable around as you're doing your massage. If also as you get contractures as well, so if you're getting sort of puckering and things like that, where it's going into a different shape, there's some of those signs that we need to have a look and see whether we need to advance some more massages and things, or scar revision surgeries and things like that.
Okay, that's very important. Any other suggestion that you want to share with? Because I know you have also a huge experience in wound for people who are in bed for a long time, so patients for these things. What are the suggestions to keep healthy in the post-op period? We don't want to go down the road of severe, infection, severe complications. So what are the main suggestions again?
So I think for me, and something I focus on with the patients, is getting them to look at their wounds as well. That's part of that acceptance phase as well. So very early on, I'll be encouraging you and supporting you through that process. I think it's kind of like watching paint dry sometimes, when, especially when you want to just be healed very quickly. Yeah. And for me, mentoring you through that process and being able to show you comparative photos and things as we're going along, because sometimes you feel like you're not making progress and you actually are. Yeah. And we can see that as professionals when you're like wound measurements are reducing, you're healing up, everything sort of the colouring is changing and becoming lighter and pink. And sometimes as a patient it's hard and you just feel like you're not making any progress. So for me that's really important. Another thing is to be mindful of as well, sunscreen, wearing that as well out.
Very important, absolutely. I always tell the patient, stay away from the sun for the first 3 months at least, or cover it up as much as you can. Yeah.
And being mindful, whilst it might be covered, your clothing might not be SPF proof as well, so you still need to wear sunscreen even if you are wearing bikinis, things like that. I always
tell, under the bikini, if the scar is under the bikini, put it the sunscreen, because even if it's black, the SPF is not enough.
Yeah, absolutely. And you'll find the hyperpigmentation, so the overpigmentation of where your scar is, the sun will almost catch more onto where your wound is than the rest of your skin. So,
And what is the treatment if somebody has a hypertrophic scar or a keloid?
Yes. So normally looking at, depending on the physician as well, and the severity of it, they get steroid injections, more massage if it's sort of on the milder side, and then sometimes for the severe stuff you might need to have corrective surgery to remove. But as it is a genetic condition, even the more surgeries doesn't necessarily mean that it's going to go away as well. So it's having a really good MDT approach, so multidisciplinary approach to it, to minimize.
I connect to this also because I do a lot of keloid removal, and over the years I've seen that just doing the removal and the steroid injection, the risk of recurrence is very, very high. So what I start doing now with a colleague, which I'll invite to another podcast soon, she's a radiotherapist. So we do a 4-day process of radiotherapy.
Amazing.
From the day of the surgery. So what I usually do, I remove the keloid, I put a sign on the dressing, so my colleague doesn't have to remove the dressing, so she knows exactly where is the scar, and she targets a machine of radiotherapy in order to reduce the possibility that this scar will develop again another keloid. And it works quite well. Still, sometimes we have a little bit of keloid, but it's more because the patient doesn't take care of that scar. So they're rubbing it, etc., etc. That's very important to understand that, again, a scar, especially a scar will develop a keloid or hypertrophic development, needs to be treated for the rest of your life in a certain way.
Absolutely. And the pressure garments also is a really important part of
that this we used a lot in the burn patients, so it's a very long process for them, and
absolutely,
absolutely important. So I think it's been very informative. I think you gave all the information that we needed. I'm very happy to work with you. Also, another thing I add before closing up, that what I like about Cass is the fact that she's not seeing the patient, thank you, bye-bye. She follows up with them. They have her own work number, so they contact her, she check up on them, etc. And she has shown me some messages that she received from my patients, said, oh, thank you so much, you're lovely. That's very important for me. You know how I approach the patient, how much my work is patient-centric. So I want the patient to feel that they are the main focus.
Absolutely.
And what I like about you is that you give this to the patients. And I know that if I have to travel, if I'm not here, or if I want the patient to have an advanced treatment of the scar, maybe I don't have the time sometimes because I'm busy, have somebody that I can trust 100%. She's very also informative with me because she texts me, send me a picture of the patient, we did that. And that's very important because we really have a full, picture on the patient itself.
Absolutely. And it's been wonderful. I think it's really good to work as part of a team on that as well, and that's close to my heart as well, is that seeing patients when they need to be seen, and encouraging them to become independent as quickly as they can, but also if I'm calling you back to clinic and I need to see something that, we're reviewing something and it's not an unnecessary visit as well. So
no, exactly. So it's nice when you're very busy, you have a lot of patients, you need to have a team, like, again, as I said, I have Sarah that filters a lot of things. I can have you that filters other things, and then I concentrate on the things that none of you can do it because only the surgeon can do it. It's very important everybody has a specific role in the process of the patient, from the booking till the healing to the final result. Absolutely. So it's a teamwork, which I strongly believe in, definitely, absolutely. So thank you so much, Cassie. It was a real pleasure. It's a pleasure to work with you. For sure, we have a bright future together coming up. If you like the episode and you find it very informative, please subscribe to the channel, hit the bell button to be informed when there is another episode coming up. And I'll see you soon. Thank you again.
Thanks very much.
Because you deserve the best.